Hey everyone, and welcome. Today, we're going to dive into autism spectrum disorder. Look, we get it. For a lot of families, this topic can be confusing, maybe even a little overwhelming. So our goal here is to just break it all down, make it super clear, and hopefully build a better understanding together.
So, we've broken this down into four main parts. First, what is autism, really? Next up, what are the signs you might actually see? Then, and this is a big one, we'll tackle the causes, separating the myths from the facts. And finally, we'll look at the path forward, what diagnosis looks like, and what kind of support is out there.
All right, let's jump right in. First things first, what are we even talking about when we use the word autism? You know, it's a word we all hear, right? But what does it actually mean? Well, the biggest clue is actually right there in the full name, Autism Spectrum Disorder.
Okay, so the big word here is neurodevelopmental. All that really means is that it has to do with how the brain develops and gets wired, right from the very beginning. It's usually defined by this unique mix of challenges with social stuff and communication, alongside these restricted or repetitive behaviors. And you almost always see these signs pop up really early in childhood, typically before age 3.
And this next point is absolutely crucial. Autism is not a disease. It's not some kind of illness that needs to be cured. It's just a different way the brain works. It's a lifelong condition that someone is born with, and it requires understanding and support, not a cure.
Okay, so if the brain works differently, how does that actually show up in daily life? Let's look at the recognizable signs, because they can look pretty different in a toddler versus an adult.
In young children, parents might start to notice a few things. There can be challenges with social stuff, like having a tough time with eye contact or not really responding to their name. Communication can be affected too, with delayed speech or sometimes even losing words they used to know. And then there are those repetitive behaviors, things like hand flapping or rocking, a really strong need for routine, or an intense, laser-like focus on just one part of an object, like the spinning wheels of a toy car.
Now, in adults, these same core challenges are often still there, but they can show up in different ways. That difficulty reading social cues or understanding sarcasm can make conversations and friendships really tough, which often leads to a lot of social anxiety. And the same intense interests and need for a strict routine we see in kids, that often continues, providing a real sense of structure and comfort in a world that can feel pretty chaotic.
So this brings us to probably one of the most common questions families have. What causes autism? Let's try to clear up some of the myths and look at what the research actually tells us.
Well, there's no single thing we can point to. Experts pretty much all agree on the main factor: genetics. It is by far the biggest piece of the puzzle. There's a really strong hereditary link, which is why autism so often runs in families.
And beyond that primary genetic link, research has found several other risk factors. Now, these things don't cause autism on their own, but they can increase the likelihood. We're talking about things like having a family history of autism, the age of the parents being over 35, and certain complications or health issues during pregnancy.
Okay, let's clear up a really important one that a lot of parents worry about. To be perfectly clear, the expert consensus is that screen time does not cause autism. The issue is that for a child who already struggles with social interaction, a whole lot of screen time can make those symptoms seem worse. Why? Well, simply because it replaces the time they could be spending practicing those skills in the real world.
So, if you're recognizing some of these signs, what's next? This section is all about that path forward, getting a diagnosis, and then finding the right kind of support.
The process really isn't as intimidating as it might sound. It usually just starts with parents observing some potential delays or behaviors. From there, the next step is to talk to a specialist, like a pediatrician or a child psychologist. They can then do a formal assessment, which just means using some standardized tests and observation to get a really clear picture of a child's developmental patterns.
If there is one single thing to take away about support, it's this. Early intervention is everything. I mean, every expert agrees that the sooner a child gets support, the better their long-term outcomes are going to be. It's all about building those crucial social and communication skills during the most critical windows of brain development.
And that support can come in a lot of different forms. It's not about changing who the person is, but about building skills to help them manage challenges. This can include things like behavioral therapies to improve communication, speech therapy for language, and occupational therapy to help with sensory issues. And yeah, sometimes medication is also used to help with related conditions like anxiety or ADHD.
But you know, beyond all the formal therapies and strategies, there's something that is even more fundamental.
A supportive, patient, and loving environment is truly the foundation for everything else. It's not a substitute for professional help, of course, but it is the most powerful tool a family has to help their loved one thrive.
And that really brings us to our final thought. Because understanding autism isn't just for the families directly affected, it's for all of us. So I'll just leave you with this question. What role can each of us play in creating a world that is more accepting, more patient, and more inclusive for everyone on the spectrum? Thanks so much for joining us.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.